Yes, top of the moment to you anywhere where you watch us from. Today na Saturday. And as it be Saturday, you know, as we dey take do am, we dey always talk about health because health na wealth. Oh, ṣe pàtàkì, ṣe kókó. Yes, like Yoruba go talk, say, na person wey dey alive. Oh. Hey, now if you enjoy the wealth. So, you're welcome to Health Matta with myself, Dr. Barth, plus the Alejo, where we promise to say day today, instead of don't day around. Amo, make I start with my oga. Good morning, sir.
Chief.
My doc.
I'm happy to be back.
I dove my fellas.
Good morning, sir. I present Kefalix.
We are learning.
Yeah, thank you very much.
Okay, sir.
Yeah, good morning, viewers at home and around the world. Today, we'll be looking at coronavirus pandemic. But this morning, we are going to look at heart, cardiovascular diseases. Cardiovascular disease. What is it all about? Also, just like you said, we have a cardiologist in the house that will do justice to the topic. Do not forget, every September 29th, the world usually commemorates World Heart Day. World Heart Day. So we just celebrated it on the 29th of September, just about 4 days ago. The theme of this year's World Heart Day is use your heart to beat cardiovascular disease.
Wow.
Use your heart to beat cardiovascular disease.
That's an interesting theme.
Yes. So we'll be looking at cardiovascular disease in the context of COVID-19 pandemic. You agree with me that this lockdown has actually encouraged a lot of redundancy, talking about people becoming inactive as a result of the fact they have been limited in a number of ways. And of course, this has given rise to increased cases of obesity, and by extension, these are some of the risk factors that can actually predispose any one of us to cardiovascular diseases. Now, do not be confused about that word, cardiovascular. I will break it down. Cardio simply means heart. And of course, vascular has to do with blood vessels. Okay. So we are talking about disorders that are associated with the heart as well as blood vessels. Additionally, clots can come in. And of course, there are a number of them. When we talk about cardiovascular diseases, there are a number of types that are very common. Of course, number one is what is known as coronary heart disease. Okay. What is it all about? Disease of the blood vessels that usually supply the heart muscles. The heart gives blood to all other parts of the body, but the heart itself receives its own blood supply from a group of arteries that are called coronary arteries. Okay, so they service the heart. Now, when they are diseased, it gives rise to coronary heart disease. Also, cerebrovascular disease, of course, that
cerebral.
Yes, that has to do with brain. When you have the blood vessels that supply the brain, when they become diseased, they will give rise to cerebrovascular disease, in which case you may have stroke and others. And of course, you have peripheral artery disease. When you have the blood vessels that supply the legs and the hand, the limbs, when they become diseased, they will give rise to peripheral heart disease. And of course, you have also rheumatic heart disease. This is usually caused by infection that are caused by a form of bacteria known as streptococcal bacteria. Okay, it usually causes rheumatic fever, which usually can cause some degree of scarring in the heart valves and muscles, and that can give rise to rheumatic heart disease. Usually, it's individuals who suffer this are people who have been exposed to episodes of tonsillitis and a number of upper respiratory tract infection. Okay. And also, you also have congenital heart disease. These are heart abnormalities that are found at birth.
Okay. On that, I think since Dr. Barth don't do what they call intro to cardiovascular diseases, I feel it is now important we bring in the big masquerade himself. Talking about the cardiologist where we talk, say, day ground, to come pieces matter, to come talk about everything we get to do with heart and COVID-19. Dr. Barth, no be rumor again, say even Trump self, he don't get this thing, and the news
talk about that in the course of
the presentation, and this news, the thing been go viral. Well, on top of that, make I yield the floor to we cardiologists waiting in the house. So let's go on this shikini break. Health Matta will be right back.
Thank you.
Cardiovascular disease is the leading cause of death on this planet.
The best way to beat it
is to use heart.
Usa cuore.
Sebenzisa inhliziyo.
Mit Herz.
To make better choices.
Usa corazón.
To prevent, diagnose, and treat early.
To improve quality of life.
To leave no heart disease neglected.
Пока happy.
Folosește inima.
Пользуйтесь сердцем.
To reduce air pollution.
To increase tobacco taxes.
To improve access to heart care and medicines for everyone, everywhere.
Akoma.
تعمل القلب.
To chase your dreams.
To live your best life.
To dance until dawn.
Hृदय उपयोग कर. Utiliser cœur.
To always be there.
This World Heart Day, use heart.
For society, your loved ones, and you.
We can't say for sure, because for you to declare a flattening of the curve, there has to be increased number of testing with detection of fewer cases. But as it is, we've noticed progressive decline in the testing rates across various states, which is as a result of lower sample collection rates. In the month of August, we discovered that testing rates declined by up to 36%, while test positivity has also declined by about 25%. So for us to really show and be sure that what we are having is actual flattening of the curve or actual decline in the number of cases and not a pseudo decline, we need to test at least as many people as we have tested before, and maintain that tempo of testing, or even improving our testing capacity on a daily basis, and then show that steady decline in the number of cases before we can truly say that we are flattening the curve. So as it is currently, COVID-19 is still very much with us in the country. The response to this outbreak is a marathon, but it is a marathon that we can win. And we can only win if collectively we all observe the prescribed public health and social measures of maintaining regular hand hygiene, Nigerians washing our hands frequently with soap under running water, wearing face masks whenever we are in public spaces.
Yes, cardiovascular diseases are the #1 cause of death globally. In year 2016, about 17.9 million people died of cardiovascular disease. And this morning, we have in the studio a consultant cardiologist in the person of Dr. Ramon Moronkola, the immediate past secretary of NMA, Lagos. He will be doing justice to the topic. He works with Lasut Ikeja. Dr. Ramon, you're welcome, sir.
Thank you. Good morning, viewers.
So
thank you for having me.
Yeah, thank you very much. So today we are looking at cardiovascular disease in the context of COVID-19 pandemic. What do we need to know? What do our viewers at home and abroad need to learn to stay to ensure that they don't end up having some of these cardiovascular challenges that, of course, can predispose one to having a very bad outcome if such a person gets infected with COVID-19. So at this stage, I would like to yield the floor to you, sir. Thank you very much once again.
Thank you, Dr. Barth. Well, it's been an interesting time. The emergence of COVID-19 has redefined many things. And one of the things it redefined is cardiovascular diseases. At least at this point, there are things we know, though there are things we are not so sure of still. But what we know is that cardiovascular disease, which you have aptly explained at the beginning of the program as diseases affecting the heart and the blood vessels, and you actually further simplified it and it refers to disease of the heart and blood vessels. We know that people that have these diseases are predisposed to having severe form of COVID infection. Just to refresh our memory, that we know that a majority of people that have COVID infection don't really develop symptoms. Those that develop symptoms usually develop mild symptoms. But for those that have any of these cardiovascular diseases, those that are hypertensive, that are diabetic, have high level of cholesterol, people that have had heart failure, people that have heart stroke, they are prone to having severe form of cardiovascular disease, which also means the chances of dying from the condition is very high. That is the one side of relationship. Another part of relationship is that even those that are healthy, those that don't have cardiovascular disease, the COVID itself, coronavirus itself, can cause cardiovascular disease. There are instances where people that are known to be healthy develop heart attack because of the COVID-19 infection. There are instances where people that have COVID-19 develop stroke as a result of that. So, what is most important to us? Because no matter what we are saying, what is important is how do we relate it to our environment? How do we relate it to prevention? How do we overcome? So what is important is that people must realize that if there's any point in time that we need to take care of our heart, that time is now. We must ensure that we live healthy, which is part of the theme of the World Heart Day this year. What the World Heart Federation is saying is that it is more important now than ever to take care of our heart. Because if you are saying that people that have cardiovascular diseases tend to develop severe form of COVID-19, and it means that those people are likely going to die if they get infected. It means the only way to prevent that situation is to protect our heart. And how do we protect our heart? We don't have to wait until we develop risk of cardiovascular disease before we start protecting our heart. We must protect not just only our heart, we must set good example, we must protect the heart of our children. So there is usually a misconception that when you are talking about diseases of the heart and blood vessels, we should not talk about children. But the reality is that a good heart in childhood will translate to good heart in adulthood and good heart in old age. So at every point in time, it's important that we prevent getting exposed to risk. We know that most people get to start smoking at a very early age, at the teen age. So we must pay attention to that. So what the World Heart Federation is saying is that as you protect your heart, set good example for others around you, for the dependents around you, for people that look up to you. Set good example. As a parent, you know that when you smoke, you're also encouraging your children to smoke. That when you smoke, you are not just setting a very bad milieu for cardiovascular disease for yourself, but for your loved one, because passive smoking is also a very big risk factor. So I think what is most important in all our discussion is how can we prevent this cardiovascular disease, and when they are setting it, how do we catch early and treat? That's what's important.
Thank you very much. Thank you very much. On that note, I'd like to open the phone lines for our viewers at home who may have one or two questions to ask the cardiologist. Okay? And I'm going to start. I have some set of questions for him. What are the common types of cardiovascular disease so that we'll be able to understand? Because cardiovascular disease, as it stands, is a group of disorders. So what are the names of these disorders for the benefit of our viewers? Thank you, sir.
Okay, I'll try to simplify it as much as possible. Heart attack is a very common word. And when we say heart attack, we call it myocardial infarction in appellars, and it means the heart is not getting enough blood itself. The muscle of the heart is not getting enough blood, and it's one of the causes of sudden death. Stroke is very, very common, and that is when the blood supply to the brain is cut off. It's one of the, in fact, it's very major. Is a major cause of death in the environment. People can develop heart failure. When we say heart failure, it means the heart is not pumping enough blood to meet the body requirement, or the heart is doing that at an expense. That means the heart is doing that under pressure. The kidney can also be affected, so part of cardiovascular disease. Also, the peripheral blood vessels. When you say blood vessels, they are like pipes that carry blood to and from the body, from different parts of the body. So, if there's a problem with pipes that takes blood to the limbs, the legs, the hands, there can be reduction or blockage of blood supply to that part. And over time, one of the things is that the individual will find difficult when he walks, he feels pains in his legs, he needs to rest, and when he walks again, he feels pain in his leg. Sometimes it can be so severe that it can lead to gangrene. That means like a death of that part of the leg, and it can lead to amputation. So that's just part of the, but you can't just mention cardiovascular disease without mentioning there are risk factors.
Very good.
Risk factors that are preventable, especially those that are preventable. There are some you can't do anything about, but those are preventable must be mentioned.
And the non-modifiable
exactly,
risk factors.
exactly. The reason we must mention the risk factors that are preventable is that is the hope that there's a solution. Because if the risk factors are not preventable, it means we don't have to talk about it. So the risk factors include hypertension. Hypertension is a major leading cause of cardiovascular disease worldwide, and the incidence is actually increasing. More than 1 billion people in the world are hypertensive. More than 1 billion people. So this is a major risk factor. These are the things, is a risk factor which we must try to prevent, and when it comes, we should also try to treat it. Diabetes is also part of it.
Let me stop you a little bit here on hypertension. Now, what is the new reading, the new normal? What is the normal reading of hypertension? Does it have to do with the age? Oftentimes, people get confused. What should be the actual reading for hypertension in adult? I do know that a number of changes have been made over the years. So what is the current reading? That, of course, when it goes past beyond this figure, such an individual will know that he or she is already hypertensive.
Well, in reality, there are a lot of changes in the cutoff for hypertension. Well, and it's a moving target. In the past, there was a time the reading was 160, 100. That was a cutoff. That was a long time ago. But as time went by, the researchers found out that even at lower blood pressure, there are some risk. But for simplicity, it's better we let our viewers know that the ideal, your blood pressure should be less than 140 above, less than 90 below. It's easier for them to understand so that we don't confuse our viewers. If you have any issues, it's better to visit your doctor, because there are other individuals in which our hope for our target blood pressure will be lower than that. But let's leave that out of this discussion so that we don't confuse our viewer. Our target, less than 140, less than 90.
Thank you very much, sir. So let's move on with the modifiable risk factors now, sir.
Okay. Diabetes is another risk factor. The reason we call it modifiable risk factor is that...
Just a minute. Let's take Ladi or Lad from Kogi. Good morning. Ladi, good morning, sir.
Good morning.
Yeah, how are you today?
Fine, thank you.
Yeah,
please, I have a question for the doctor in the studio.
Okay, please go ahead.
Okay, if somebody is sitting on a chair like this and is feeling pain on his lap, underneath his lap, what's the cause of that, sir? And at times, his heartbeat will be very, very high.
Okay, so he will respond to you. Thank you very much.
All right, thank you.
I appreciate it.
Yeah, so if you see your heartbeat is very fast, that means it could be like you are aware of your heartbeat. That means the feeling of when you run or when you are scared, that pounding feeling you have, we call it palpitation. So when you have that, there are lots of causes, possible causes of palpitation. It could range from what you take, it could range from emotional issues, or a frank heart condition itself. So the best thing to do when you have such feeling is to visit your doctor, who will ask further questions and carry out some tests. That is majorly what you should do. Now, feeling pains in the lab, many things can cause that. I don't know, maybe it could be that you are sitting on the spot for a long time. And it could also be part of a cardiovascular disease. So what's important is that you ask your doctor, who is going to examine the place, to examine you generally and find out if there are issues.
Yeah, thank you very much. So let's go back to, you were doing some explanation on the risk factors.
Exactly. So there are, high salt intake is a risk factor for cardiovascular disease. High salt intake, high consumption of saturated fat, sedentary lifestyle. That means you sit down in a place for so long. Especially during this period of COVID, when people were out to be working from home, you wake up in the morning, have your bath, you come back and sit down and start working. You are behind your laptop for a very long time. That's the risk factor of cardiovascular disease. Lack of exercise is also a risk factor. Obesity is a risk factor. In fact, a combination of hypertension, diabetes, obesity, and high cholesterol, they are one of the major leading.
Just a minute. Good morning, sir. Yeah. Please turn down the volume of your TV set so that we can hear you, sir. It's still loud somehow. You can do better, sir.
Yes.
Okay, go ahead, sir.
I had your discussions.
Thank you.
So I want to ask, how can we prevent the cardiac arrest occurrence?
How can we prevent what, sir?
What is the solution? Or what can we do to prevent the occurrence of this cardiac problem?
Okay, thank you very much. Thank you, sir, for calling. The doctor will take all your questions.
Yeah, exactly. That is what we were discussing. So we're talking about those things that predispose people to developing cardiovascular disease. So we talk about high salt intake, consumption of high refined food, which is high in sugar, high saturated fat intake, sedentary lifestyle, obesity, lack of exercise. So these are just part of the risk factors. And just like a caller said, which is what we are going to talk about after that, which is prevention. We should realize that prevention should start from primary, secondary, and tertiary, which means for those that don't have the disease, we should start from there. The fact that you are healthy doesn't mean you should not prevent cardiovascular disease. The fact that you are healthy doesn't mean you should throw caution to the wind, drink excess, be taking excess alcohol, which is a strong risk factor, and smoking. So you must avoid smoking, avoid excess alcohol, cut down your salt intake, avoid refined sugar. Bottled drinks don't have any place. And this discussion also applies to our children. We shouldn't say because they are children, they can have unlimited access to chocolates, bottled drinks, refined sugar. No. The protection of heart starts from that point. So for those that may have developed cardiovascular disease or those that have developed some of the risk factors, we must try and identify them on time and treat them. Regular clinic visit, take every opportunity you have to check your blood pressure and other risk factors, check your sugar. Is one of the ways to do that. So that when you find out that you have hypertension, you can treat it. The good thing is that for those that are hypertensive, if in as much as your blood pressure is normal, through whatever means, that means either use your lifestyle modification by doing all the things I mentioned earlier. You try to reduce your salt intake, avoid refined sugar, you do exercise, you consume a lot of fruits and vegetables, the risk is drastically reduced. Or you may also need to take drugs. In as much as your blood pressure is controlled, the risk is drastically reduced. So, if we are able to do that, and for those that have developed the disease, if they visit their hospital regularly, their doctor regularly. Okay, we have a caller.
Yes, we have a caller. Usman from Kaduna. Usman, good morning, sir.
Good morning, sir.
Yeah, thank you very much.
Yes, sir.
Please go on with your contribution or question.
No, it's a question. I'm going to ask a question.
Yeah, go ahead, sir.
Yes, I have this issue. I have this palpitation, but again, because it is heartbeat, my heart is beating a little bit fast, and again, my lower abdomen is paining within my lower abdomen. And again, I went to the doctor. I did X-ray, I did echo, I did ECG, but all did not show anything. So I don't know what is the issue precisely. So let me just ask the doctor.
Okay, thank you very much. Doctor will respond to you.
Okay, yeah. That's a good one. At least you have taken some steps. That means you have tried to do some tests. You have seen your doctor. Now, the reality is that, just like I said to the last caller, maybe I should expatiate for that. Some things we consume can be the cause of our problem. For some, coffee may just be the reason they're having palpitation. Some of this herbal tea, which is getting common now, there are lots of names they give it to it, whether ginger tea, there are lots of names given to it. That might be the cause of the problem. Now, the heart, just like the whole human being can be irritated. So the heart itself can also be irritated by some things we consume. So if you take things that are unusual, look at it and avoid them. A typical example was found during this COVID. You know, people prescribe all sorts of things as means of preventing COVID during this period. People mention turmeric, mention garlic, ginger. So you see people blend all sorts of things, mix it, and drink it every morning. The reality is there's nothing with that. There's no thing you put in your mouth that doesn't have, not have side effects. So people who are taking excess of this thing,
water.
I think water too has side effects. There's nothing that can have if you consume it inappropriately or in excess. It can be side effect. So people took all sorts of things and they started coming to clinic. I attended to not less than 20 to 30. And the reason for their visit was what we're consuming. And we should also realize that the rate of alcohol consumption in the environment now is very high. What people just do is they give one name to any attractive name to a bottled bitter. They say it's a bitter. Then they add excess alcohol, very high alcohol content. People misconstrue this for means of treating themselves or means of staying healthy, and they consume it in excess. Meanwhile, what they are just taking is alcohol. So they fall into the category of those consuming excess alcohol. Check what you take in. It is important now that whatever we buy, let us read the label. What is the content? What is the salt content? In fact, salt is one of the things we use in preserving food. So for preservatives, most of the preservatives in the refined food we buy is salt. So there's a maximum amount of salt we are allowed to take in a day. But some of those things, some of those chips and stuff, we just buy a package. The salt content, in fact, may be as high as what you ordinarily consume in 2 days. So that these are some of the things that are pushing cardiovascular disease in the environment. And before I forget, this idea of cardiovascular disease prevention should not be left to the individual alone. We have a caller.
Yes, sir. Good morning, sir. Fatai from Kogi.
Good morning. It's Fatai calling from Okene.
Okay, you're welcome.
Yeah, please. I want to confirm, is it true that when you start taking medication for high BP, you cannot stop it? Or the moment you try to stop taking it, the blood pressure will rise again? Thank you.
Thank you very much. The cardiologist will respond to you, sir.
Thank you for that question. That's a very common question. And, there are lots of old wives' tales that is peddled around. What is important is that we ask and seek clarification from the appropriate quarters.
Very important.
Now, the purpose of taking blood pressure medication is that your blood pressure is high. Now, as I mentioned earlier, treatment of high blood pressure is categorized into 2. There is lifestyle modification, then there is use of antihypertensive drug. If you come to the clinic and your blood pressure is high, if it is not so high, maybe it is just mildly high, what your doctor will try to do is to ask you questions surrounding your lifestyle, what you eat, examine you, to look at other things that may be pushing your blood pressure high. Like, for example, if you are taking excess alcohol, that may be what is pushing your blood pressure. If your doctor is able to identify that, he will tell you to modify your lifestyle, stop smoking, reduce the alcohol you are taking, reduce your salt intake. That on its own may be enough to control your blood pressure.
Thank you. We've been on alcohol intake, harmful use of alcohol, excessive use of alcohol. What should we regard as the safe use of alcohol?
Okay, that is another discussion I won't want to go into. The reason is because when we say we should have reasonable alcohol, as in you should limit your alcohol consumption to a reasonable amount, we should put that back of our mind. Alcohol itself can be addictive. So, well, generally, no more than one, you shouldn't take more than 2, some say 3 bottles in a week. You understand?
Okay.
But the lower you can reduce it, the better for you. One caveat, what people usually say is that they said alcohol is good for the heart. Well, there are studies that have shown that. But remember that some of these studies were done outside the country. That's the reality. So if you are going to consume alcohol, always ensure that you reduce it to the barest minimum. The part of the reason is that it can be addictive. When you start consuming alcohol, some can control themselves. For those that can't control themselves, it tends to be cumulative, tends to increase it. For social drinker, yeah, it's fine. So some only take alcohol when they go on occasion and they are able to control it. But we must realize that alcohol can be a cardiac irritant, can damage the heart muscles directly. So for some people, there are instances where people can take excess alcohol, especially in alcohol binge situation, and it causes sudden cardiac death. So, as I was saying earlier, talking about preventing cardiovascular diseases. So we've talked about individuals. I said this should not be left to individuals alone. Institutions and communities should also contribute. Companies, when you have a company, you must also seek to cardiovascular health of your employees. Providing ergonomic tables for your employees that you think will have a long screen time, so that they can stand where they are. Sometimes they can adjust their table, raise it up, and move around with it within the office. Create dedicated time for exercise. Your break time, ensure the food in your restaurant, your canteen, even in our schools, that people have healthy options. You don't just limit the options. When people say it's break time, you go to a restaurant. What you find there are some of these high refined, bottled sugar, canned foods. Those are the only things available. We should avoid that. We should also take it to a level of community. There's nothing wrong in us having fitness clubs, encouraging ourselves to be healthy. For those that have some of these cardiovascular diseases amongst us, we should identify ourselves and provide psychological support for each other. That is what the community can also do. The government has a role to play. The government ban on tobacco, for example.
Talking about population-wide interventions now.
Exactly. So, ban on tobacco, increase tax on some of these dangerous substances. In fact, I mentioned the issue of proliferation of small sachet alcohol now. I think government is trying to do something about it now. People put wrong label on some of these things, saying that it contains a herbal mixture, it can prevent all sort of things, and people misconstrue it and take it wrongly. So government has a role to play. In construction of roads, government will provide sidewalks, clearly demarcated, so that people can have option. The reason most of our people don't take option of walking, it's dangerous. You can be walking on the road, this bike guy can hit you down. There's no path to take. I know there was a governor of Lagos State
we have
that ensured that.
Just a minute.
Okay, we have another caller.
Yes. Good morning, Chooks.
Yes.
Yeah. Go ahead with your question. Should there be any?
Okay, my question is this. The man on the screen says refined sugar should be limited. The consumption of refined sugar should be limited. I heard you say something like that.
Okay.
What are included in refined sugar so that one will be aware of what he's taking?
Thank you very much, sir. So he will respond.
Thank you. In fact, the question is very germane, very important. So we may miss some of the details in this thing. When you say refined sugar, the sugar, your table sugar you add to your food is a major one to start with. So, as much as possible, if you are taking your tea, if you are going to add sugar, you should put at the back of your mind that excess of this thing is bad. So, most of the bottled drinks, the sugar content is unimaginable. If we can avoid them, let's avoid them. So, some bottled drinks may contain as high as 10, 12 cubes of sugar. And this is what you just pick one for at a go. You drink a whole bottle at a go. I'm sure beyond, if not for drinking that bottle, you wouldn't have consumed that amount of sugar in the day. So that's what we say refined sugar.
Thank you very much. Before we go on the next break, I would like you to briefly talk about the non-modifiable risk factors, so that at least people who have such predisposition will be well aware ahead of time. Okay, well, yeah, for mentioning sake, so that we will realize that there are some things we can't do anything about. A very typical example is age. The older you get, the more likely, the more likelihood that you develop cardiovascular disease. There's nothing you can do about that. Hereditary. If your parents have hypertension, your dad, your mom have hypertension, there's likelihood that you also going to develop hypertension or some of these cardiovascular diseases. Just like you inherit your fine face, your huge body from your father, you can inherit those ones too. It's not only asset we get from our parents, we can also get liability. Just realize that. It's on that note that we'll be going on the next break. Thank you so much.
Cardiovascular disease is the leading cause of death on this planet.
The best way to beat it
is to use heart.
Usa cuore.
Sebenzisa inhliziyo.
Mit Herz.
To make better choices.
Usa corazón.
To prevent, diagnose, and treat early.
To improve quality of life.
To leave no heart disease neglected.
Покай happy.
Folosește inima.
Пользуйтесь сердцем.
To reduce air pollution.
To increase tobacco taxes.
to improve access to heart care and medicines for everyone, everywhere.
استعمل القلب.
To chase your dreams.
To live your best life.
To dance until dawn.
Rudeica Ubeoka. Utilise cœur.
To always be there.
This World Heart Day, use heart.
For society, your loved ones, and you.
Hello? Tunde, it's been ages.
Maka, I'm so tired of this coronavirus pandemic. I am inviting you to my birthday bash next Saturday. All our friends are going to be there.
Wow, that is awesome. But I'm sorry. You know my condition now. I am managing and I can't risk corona.
Amaka, you're on even too much. Corona cannot affect young people like us.
That's not true. Coronavirus affects young and old people, especially those of us with underlying health conditions. We must be very cautious. I know families who have lost their young ones too.
So this coronavirus is real. I am calling off the party.
Even young people are at risk. Be like Amaka. Do not take risks. Wear your masks correctly if you go out. Wash your hands regularly. Maintain physical distancing. It is better to do over syllabus than to regret.
This message is from the Ministry of Health, Ministry of Information, NCDC, and partners.
Everyone has to wear a face mask to reduce the spread of COVID-19. Wearing face masks appropriately can help prevent the spread of COVID-19. So the more you wear your face masks, the better. Whether you are on your way to work, the market, or the bus station, always wear a face mask. When an infected person coughs, they spread tiny droplets filled with the virus into the air. Wearing the mask helps to reduce the amount of virus being spread by an infected person. When wearing a face mask, make sure it covers your nose and mouth. You do not wear it on your neck or under your chin. Avoid touching your mask often. Dispose of it hygienically. Face shields will not protect you from COVID-19. Avoid wearing them. If you must, always wear it with a face mask. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
Baba Risi, you been there sleep when government motor show for inside area this afternoon. No. Now so them take enter Sisi Clara house where they the other side. They can't come out with some kind of medical equipment. But it be like say she don't catch the coronavirus where people they yarn about. Oh, itself we no safe for inside area again. No, Kai, I no go even pass that house again.
Mama Risi, haba. Sure you know say they good make government to check everybody where they suspect say they don't contact with people who don't carry the virus.
You
no mean say dem get am now. Even if to say the person get am, e mean say dem go just carry am make e collect treatment. If person get the coronavirus, e no mean say the person don die. Person fit still recover, or when they don suspect say somebody get am, dem go do test. Dem fit even treat the person fast. Plenty people wey catch the virus after dem collect treatment, dem recover. When these government people come, make we allow them, make them test you.
This message now from the Federal and State Ministries of Health, Ministry of Information, NCDC, and them partners them.
We all know wearing a face mask is not very comfortable, but the risk of getting infected with coronavirus is much higher when you are in public without a face mask. Ensure your nose and mouth are covered properly while in public places or in a closed area with several people. Wash your hands regularly and maintain social distancing. You are not at risk of getting infected from people who have recovered from the virus. Do not stigmatize against them. Stigmatization increases the chances of community transmission of COVID-19. Remember, anyone can get infected. Together, let's fight COVID-19. This message is brought to you by the Risk Communication and Community Engagement, Public Health Department, Health and Human Services Secretariat, FCT Administration.
Yes, you're welcome back to the show, and we'd like to appreciate Dr. Ramon, yes, the cardiologist. We say he take us through a whole lot as far as how to maintain good heart condition they're concerned. Plus, I will also have to say a big thank you to the World Heart Foundation for the materials we will be used. Also, a very big thank you to Dr. Barth himself too for helping out do justice not only on top of COVID-19 but even extending it now to cardiological issues. So we'll say a very
thank you
big
very
thank
much.
you.
Thank you very much.
A whole lot has been happening during the week. Flipping through my phone now, I can even see people calling out this doctor. Then I was saying she has this hydroxychloroquine, and a whole lot, vis-a-vis the Trump case. What have you to say on this?
First, thank you for those questions and observations. I would like to start by wishing the Trumps, talking about the president and the wife, a quick recovery. Not just themselves, but all other people who are stricken globally with COVID-19 disease. Okay, so we are wishing them a quick recovery. I do know that not just Trump, a number of his aides were equally infected along the line. Just this morning, I also read that his chief campaign director was equally infected. Okay, so a number of people may have been infected in the White House. So that speaks volume of what we need to do as individuals. For those of us who have lost or have played down on the infection prevention protocols as directed by government agencies and some other reputable health organization, it's just for us to know that COVID-19 is still very much here with us, even here in Nigeria. The risk of infection of COVID-19 is still quite high. And of course, we do know that all schools now have resumed. Our international airspace has equally been opened, and we should expect to see upsurge in the number of cases we have. What we need to do as a country, we just celebrated our 60-year independence. We need to rededicate ourselves. Okay? We need to reaffirm to build a nation that all of us should be proud of. Yes, we may have had a number of challenges here and there as a people, but all of those have helped to unite us and make us one indivisible nation. And I also want to use that opportunity to call on all Nigerians, our viewers at home and our global audience, please know it today that COVID-19 is still very much with us. The risk of transmission is still quite high. The Trumps have been infected. Anybody can be infected. COVID-19 does not respect barriers, does not respect boundaries, does not respect status. Anybody can be infected, especially when we drop our guard, when we don't use face masks, when we're in public spaces, and when we don't regularly wash our hands, And when we don't maintain social distancing and avoid crowded places as much as possible, if you must make that trip, if you must make that travel, you need to find out how important it is to you.
Okay, Dr. Barth, I want to quickly ask this question because you talked on last week, and from where I first see him, but the thing don't come there everywhere now. I don't know, this air doctor, they call it, that thing that looks like ID card. I saw it on some public figure's body. Well, I don't know how, yes, I know that thing saying a medical something. But the question I want to ask you be say, even though if you go work, like how many hours if it's sustained, where person go talk say still dey valid, or na something where person fit carry for as long as 1 week, 2 weeks, and e go dey doctor the whole COVID-19 like they call am.
A doctor the environment. Some call it COVID buster, a COVID virus buster, a number of names. Now, the truth of the matter is that I'm happy that NCDC has actually issued an advisory on this COVID, on this a doctor stuff that we're talking about. So all of us can actually go and read it. They've said there is no scientific backing that this can protect anybody. Okay, we have it displayed on our screen. Okay, so the link will also be shown to us. NCDC has actually come to say, yes, I do know that a number of prominent individuals are wearing it. You can see some of them even on our, we have
Yaka
from Cross River. Good morning, sir.
Good morning, Iyaka.
Hello, good morning.
Yes, sir. The doctor is here, sir.
Okay. Can I talk with him?
Yes, you can.
Okay. Good morning, Dr. Barth.
Good morning, sir. How is Cross River today?
Cross River is cool.
Okay, sir. Go ahead. I can hear you. Go ahead, sir.
One of the callers asked Dr. Barth that if you are on the BP medication, is it that you must continue or you can take and stop when the BP is down?
Okay, thank you very much. Thank you very much for bringing that question to the fore once more. Now, what I usually advise my patients, I have a perforator somewhere in my office. I usually use it to make a demonstration. That will drive home the message, and I'm going to talk about that this morning. Now, what you can do when someone is diagnosed with hypertension, for instance, there are two ways to go about it. Non-pharmaceutical interventions as well as pharmaceutical interventions. Non-pharmaceutical interventions is the way we can treat hypertension without the use of drugs. Pharmaceutical interventions are treating hypertension by the use of some drugs. Now, it depends. The doctor will be the one to make such a judgment for a patient. Now, the way it is, when you have high blood pressure and you've been put on drugs, if you stop taking those drugs, once you maintain those drugs and attend your regular clinic, the drugs may be stepped up, the doses may be stepped up in some cases, or some other ones added, or may equally be reduced, depending on the readings that you're getting on your clinic visitation. Now, but when you're on your drugs, what it looks like, the analogy is like this. It's just like pressing one's hand on top of a perforator with a spring. So when you press it down, it will decompress. That is when you're using your drugs regularly as it should be. So your BP stays controlled at that time. The moment you stop using your drug, it's like taking off your hand from that compressor, from that perforator.
The springboard
springs up again. It rises again. So your BP shuts up again. So that is what happens. However, I will also go a little bit further. In pregnancy, we have a number of types of hypertension. Okay? You could have pregnancy-induced hypertension. People who have pregnancy-induced hypertension, just like the name implies, that hypertension was brought about by pregnancy. Ab initio, before they became pregnant, they probably didn't have it. Okay, so once you have such set of people and you're in such a situation as a woman, after delivering your child, over time, doctors may put you on drugs over a period of time, but immediately after you deliver your child, it will take some few weeks to few months, your BP will get back to normal, and the doctors may stop your drugs, and you won't have to be on drugs for the rest of your life. But 10% of people who may have such conditions may develop outright hypertension afterwards, and the hypertension will never come back to normal. Okay, so some people who have hypertension is usually a lifelong affair, and that is why we refer to it as chronic illness. Okay, so that means the treatment will have to be for the rest of your life. But the notion, I think, people usually paint is that once you take the drug for 1 or 2 days and you stop it,
feel right.
So you can't stop taking it. You just have to. No, that is not the picture. For people who have pregnancy-induced hypertension, after delivery, when their BP normalizes, doctors will usually stop the drugs, and those people may not have it again. So that is a case scenario that will drive home the point.
Okay.
Thank you very much.
Iyaka, I believe that answers your question. So, Dr. Barth, you did demystify the notion on air doctor before we went on that break, vis-a-vis say some other, you don't even see some prominent people, they hang down.
Yeah. I don't want to mention anybody's name, but
at least,
yes, it's important we point it out. The air doctor of 18 does not have any scientific backing that it purifies or disinfects the air around whoever wears it.
It's not herbally made, it's medically made.
A whole lot of things are flying around these days.
That's true. Yes, I believe.
Okay, some of them were made by charlatans.
Yes. Pastor Amos, good morning.
Good morning.
How is Oyo?
Ibadan is cool.
Ibadan is cool. Okay, the doctor is here.
Hello, doctor in the house. How are you?
I'm fine, thank you, Pastor Amos. Good morning, sir.
More grace to your elbow. We are enjoying you.
Thank you very much, sir. Thank you very much, sir.
My only contribution as to this program, I'm not asking questions.
Okay.
For us to enjoy you more, the way you are entertaining questions, we always abort the explanation you are giving us. So I suggest if you are enlightening us after your own contribution, you give room maybe the last 10 or 15 minutes to entertain questions, because when you are giving us and we are following your explanations, when another phone comes in, it aborts the explanation. And most cases, you don't go back to where you stopped.
I agree with you.
So it's just my observation. It's a fine program, and I'm enjoying it.
Thank you very much. We'll make necessary adjustments, sir. I can promise you that.
Thank you.
All right, sir.
Thank you very much, sir.
Thank you, sir.
So I would like to give us a global update of where we are at the moment on a global scale, where we are at the moment. Okay, now, as it stands now, US still tops the chart. Over 1 million people have lost their lives to COVID-19. And of course, we know that global affectation has gone beyond 34 million. And more than 25 million people have equally recovered from the global pandemic. In our African region, I'm happy to say and to announce that the number of new cases we are seeing in Africa are actually dropping across all the countries in Africa. South Africa in the last 24 hours recorded 1,749 new cases. At a point, South Africa was recording up to 5,000 at the peak of the pandemic. Morocco comes second in Africa. South Africa currently has 677,833 persons that have been infected with COVID-19. Morocco has 128,565. Egypt comes third with 103,466 individuals infected in that country. And of course, after Egypt comes Ethiopia with 76,988 persons. And Nigeria is fifth on African list with 59,127 persons. In terms of the number of deaths that Africa has recorded so far 36,288 deaths, unfortunately. Okay? So it's just for us to know that COVID-19 is still very much with us. Madagascar is 13th on the list. Total cases in Madagascar at the moment stands at 16,493. And Madagascar in the last 24 hours saw 39 new cases. Of course, our own country, Nigeria, in the last 24 hours, we recorded 126 cases.
Wow. Okay, Dr. Barth, on that premise, we say a very big thank you to you. We say a very big thank you for the lovely job, and we say thank you to our viewers too. Keep it the same time, same day with us. Saturday when Health Matta shall be coming your way again.
We'll be back.
Happy weekend. Yeah.